everyone hear me okay? Yes? I'll maybe just stand for this bit so I can see you at the back. I'm Shona Robison, Cabinet Secretary for Health, Wellbeing and Sport, and it's very good to see so many people here. We have a very warm day in Aberdeen today and a very warm room, so I hope that we can maybe get a bit of air circulating, but I can see that people are quite warm, so please take your jackets off and relax. We've got a very important session here today. I've already had a number of meetings this morning as part of the annual review, so I've met with staff in the area clinical forum and heard what they have to say. I've met again with some of the staff side representatives in the area partnership forum, and importantly I met with patients to hear their perspective on the services that people are receiving here in the Grampian area. The annual review, for those of you who have not been to one before, is an opportunity to hear about what the board have been doing in the services over the last year since the last annual review, but importantly the look ahead to the year ahead and the plans that they have. And it's important that that happens because each health board spends a lot of you, the taxpayers' money, and therefore you should hear about how they're investing that resource on your behalf. The review's going to happen in two parts. The first in public, and after the chair has made his presentation and set the scene, the floor will be over to you to ask questions. After this session, we are going to be meeting with the board to go into a little bit more detail around the plans that they have, and we'll be doing that later on this afternoon. I should really say who we have here, and John Matheson will start with yourself. Do you want to introduce yourself, John? Say who you are.
Afternoon, my name is John Matheson. I'm the Director of Health Finance, eHealth and Analytics.
Okay, John Conaghan.
Yes, good afternoon. My name is John Conaghan and I'm the Director for Performance. Thank you.
And we have Paul Gray.
Hi, I'm Paul Gray. I'm the Chief Executive of the National Health Service in Scotland and the Director General for Health and Social Care at Scottish Government.
Okay, and these guys are important to me because they'll be helping me to ask some of the questions later on today, and to hear from yourselves as well around feedback from you as patients, as staff, as members of the public. So I'm going to hand over to Malcolm and Stephen. Stephen, do you want to introduce yourself first, and then Malcolm can introduce himself, and then you can get on with your presentation.
Well, thank you, Cabinet Secretary. I'm Stephen Logan. I'm the Chairman of NHS Grampian.
And I'm Malcolm Wright. I'm Chief Executive of NHS Grampian.
Stephen, do you want to?
Thank you. Well, Cabinet Secretary, ladies and gentlemen, colleagues, I reiterate the Cabinet Secretary's warm welcome to you all here today, and I'm glad to see such a large audience. For the next 15 or 20 minutes or so, I'd like to tell you about what we've been doing in Grampian over the last year and also our plans for the future. I'm sure you all know 2014 to 2015 was a challenging year for the NHS in Grampian. However, since the last annual review on the 12th of January this year, we've made significant progress across a number of fronts. Throughout the organisation, we have outstanding teams of healthcare professionals and management committed to working together for the people of Grampian. I've seen this firsthand in the 7 months I've been in post, and this, I believe, holds us in good stead for future successes. We've made significant and sustained improvement in performance, and evidence for that is in our self-assessment document. We've met most of the national targets and standards set for boards in terms of health improvement, efficiency, safety, and improved access to care, and I'll touch more on these later on. We've done this at the same time as delivering an extensive improvement programme and maintaining the huge range of activity that goes on a day-to-day basis in NHS Grampian. Some of those activities are illustrated for you on the slide. We're focused on ensuring that services across Grampian are of the quality and safety that our communities deserve. Quality and safety is everyone's business. Above all, we're committed to continue caring, listening and improving. I want firstly to mention the reviews undertaken last autumn by Healthcare Improvement Scotland and the Royal College of Surgeons. Whilst neither of these showed consistent or widespread concerns about patient safety or the quality of patient care, they did make a number of key recommendations which the board accepted in full. A comprehensive improvement programme was produced after wide consultation and agreement with Scottish Government and Health Improvement Scotland, and progress with implementation is formally monitored by our NHS board and the Scottish Government. We also have regular and ongoing engagement with the General Medical Council and NHS Education for Scotland. I'm going to address in the next couple of slides some of the actions that we've done to implement the findings. I'm particularly pleased that we've appointed Malcolm Wright as a substantive chief executive and Amanda Croft as Director of Nursing, Midwifery and and Allied Health Professionals. We've implemented new management arrangements within ARI, and we've also strengthened clinical management with the appointment of associate medical directors. We're currently seeking to fill the Director of Public Health position. Over the last year, we've increased engagement with the advisory structure and now undertake regular joint advisory structure NHS board seminars on key topics. We've significantly progressed the actions relating to general surgery and older people's care in acute hospitals, and we've also delivered better than Scottish average performance against the 4-hour A&E standard since December. Other improvements include more comprehensive job planning, with 85% of consultants now having agreed job plans. We're also strengthening nursing professional governance arrangements, and a nursing leadership development framework is in place. We've improved our processes for responding to patient feedback and now meet response time standards. And more importantly, we're using feedback as a learning tool to support improvement. And I'm very pleased to say that between June 14 and May 15, 96.2% of our patients rated the care they'd received as good, very good, or excellent. The board accepts its responsibility for establishing standards of conduct and behaviour and providing a dignified workplace for all of our staff. We've taken appropriate action to address the serious findings raised within the reports regarding values and behaviours. We encourage and support multi-professional team working. We will tackle robustly personal and professional behaviour that is not consistent with our values. We expect all our services to implement a positive and constructive culture of respect, dignity, trust and openness, no matter which individuals involved and what their status is within the organisation. Our staff experience work has so far asked over 700 staff about their work experience, and 75% had assessed their day at work to be good, very good, or excellent. So, I'm going to look now moving forward. It's important that we now look to the future. NHS Grampian has ambition to be a high-performing organisation, safe, effective, caring, responsive, and well-led, providing world-class services. This is reaffirmed by our vision and values and our objectives. We're about improving health and reducing inequalities. We're about delivering high-quality care in the right place. We want to involve our patients, the public, staff, and our partners. And we want to develop and empower our staff. In terms of improving health for all, we're supporting a variety of headlines here, and I'm going to talk about them with some examples of each of them. So we're supporting a healthy lifespan. For example, the Family Nurse Partnership Programme is a health visiting service for young mothers. We're also supporting self-care and self-management. 39% of people in Grampian have at least one long-term condition, and we believe it's very, very important for them to develop self-care and self-management as part of the treatment. We're supporting healthy places. 36 organisations in North East Scotland received a Healthy Working Lives Award at a national ceremony this year. And we're taking forward a health promoting health service across the acute sector. We're supporting healthy environments. Healthy Eating Active Living programme is a very important programme. 38% of adults in Grampian and the North East are overweight, and a further 25% are obese. And these numbers are increasing. This is going to be an incredible increasing burden on our health service because of the additional demands made with the conditions associated with obesity and overweight. We have a tobacco control strategy. Our grounds are now smoke-free. It's a significant achievement. And we know, however, that this has raised some issues with our neighbours, and we're urgently dealing with the challenges of litter caused by smokers at the edges of our sites. Our own smoking advice service had the highest quit rates at 4 and 12 weeks in Scotland in Q1 of 2015-2016. We're supporting social justice by targeting resources towards less advantaged communities, continuing the Keep Well programme and providing health checks in a variety of different settings. Patient safety and quality is at the heart of all we do. Our patient safety programme now covers all sectors, including a pilot in primary care pharmacy. We have quality improvement facilitators to support the programme across the organisation. We have continued excellent performance in relation to healthcare associated infection standards. And whilst figures can fluctuate, our levels of infection remain amongst the lowest in Scotland. Over the last year, we've had external inspections of ARI, Woodend, Aberdeen Maternity Hospital, Inverurie Hospital and Dr. Gray's. We very much welcome these inspections, and these have generally been positive, with Inverurie inspection in particular having no recommendations for improvement. Amongst our staff, we had 20 posters accepted for display in the 2015 NHS Scotland poster event, and won the person-centred category with a poster about homeless patients and their medicines. And if you have time, some of the posters are on display outside this room in other rooms in this building. You may have a chance to look at some of them. We held our own 7th Champions Challenge and 4th Quality and Safety Healthcare events. Both were very successful and attended by large numbers of our staff. We're very interested about feedback and creating a positive experience of care. And we actively seek patient feedback to inform our learning and to improve the services we deliver. We use patient stories widely, including at the NHS board. I have great appreciation of this, and it gives all us board members a great insight to particular incidents or events around patients, carers, their families. It brings to our attention a series of events that take place around specific cases. We respond to patient opinion, the online site about experiences of health services, and we're committed to its further development. We're supporting real-time patient feedback and have produced a video about this, which is available as an example of good practice on NHS Scotland's staff governance website. And we're using social media, and through this are reaching a different and wider audience. We're always concerned about improving performance, and we've worked closely with Scottish Government, and I wish to express my thanks to you, Cabinet Secretary, and your officials for the very supportive input to this. We've agreed a comprehensive waiting times plan with clear targets. We've invested an additional £9 million in staffing, equipment and theatre capacity over the last 2 years. Sustainable delivery of the 62-day cancer referral to treatment target remains a challenge for us, but it is a key priority, and the additional investment that we've made will enable this to happen. We have an agreed plan to meet child and adolescent mental health and psychological therapies access time standards. Both services have experienced staff shortages, but the position is now improving. We're working to improve patient flow in and out of hospital to ensure care is provided in the right place at the right time and that delays are minimised. We're working through our shadow integrated joint boards with our local authority partners to achieve improvement in our performance. This remains a serious challenge for us, largely related to the availability of care home places and care at home services. And our efforts are focused on increasing capacity in this area and building and sustaining quality care for our population. In spite of the outside temperature today, we are preparing for winter. We're in the process of submitting our winter plan to the Scottish Government later this month. Let me turn now to making best use of our resources. We met our 3 financial targets in full in 2014-15. This, colleagues and friends, is a very significant achievement. I want to congratulate all staff in NHS Grampian who helped contribute to this, and also to the Finance Director and his team for making us constantly aware of where we were in order to achieve those targets. During 2014-15, £54 million capital investment was made in Aberdeen Health and Care Village, Wood End and Forest Health Centres. Additional theatres at ARI and Wood End, which the Cabinet Secretary visited this morning, new PET CT scanner, and a great deal of significant infrastructure improvements have taken place. We're committed to further investment in primary care premises over the next 5 years, in excess of £40 million, and the new Baird Family Hospital and Anchor Cancer Centre, together coming to £120 million. Cabinet Secretary, we greatly welcome the funding, which takes us closer to the NRAC formula funding parity. We have a strong embedded partnership working throughout sectors, and staff and management team have been fully engaged in the development and delivery of our improvement programme. We have 27 more consultants and 234 nurses and midwives compared to last year. We remain one of the best performing boards in terms of managing staff absences. We support staff who are off work through our intelligent absence management system. We engage our staff through a variety of internal communications, including face-to-face walk-rounds, and walk-rounds are where board members and members of the executive team take some time to walk around different parts of the NHS. There have been almost 300 of these walk-rounds since they began. We've begun to roll out the national staff engagement tool called iMatter, and in the first round of this, we've had a response rate of 87%, and results are currently being discussed with the various teams across the NHS Grampian. Our response rate in the National Staff Survey continues to increase, and these results are used with sector partnership forums. The GRAFTAs, our very own special award ceremony, were held for the 3rd year in November 2014. It's a great ceremony about celebrating the truly inspiring work of teams and individuals across Grampian. And one of the roles I had this morning after meeting with the Cabinet Secretary was to work with some of my board colleagues to look at this year's nominations and shortlist individuals. It was a truly inspiring and inspirational event, looking at the quality of work that individuals contribute, both individuals and teams contribute to our NHS. Our staff and teams have once again won many national awards and accolades, and I'll single out 2, although it's unfair just to single out 2. There's a separate list of all the awards and winners are here today. But Dr. Derek King took first place in the Scottish Health Awards Doctors category, and Wendy Boyd, who won the Scottish Dermatology Nurse of the Year. Primary care and general practice. We're committed to ensuring we have a sustainable model for general practice and working closely with all practices where there are workforce challenges. We're investing £45 million in new premises. Woodside and Forres are now commissioned, and we're planning for Inverurie, Forester Hill, Denburn and replacement buildings in the north of Aberdeen. some examples of some of the very creative ways we're looking at how general practice may change itself. To date, we've had 6 practices across NHS Grampian specifically supported to explore the future for general practice. These practices embraced a concept of modernisation and the need for a significant shift in the way we work. Community Renewal is an organisation with extensive experience in working with communities and has been commissioned for a 3-year period supported by Scottish Government funding. They're working with the practices to change the conversation with the public and to look how the public can be linked into increased resilience in self-management and integrated with community activities which promote health and well-being. They're also looking at how staff interact with the public in the practice and working on the skills and confidence in supporting people in different environments and in different ways. Staff Well is a programme aimed at supporting staff in the practice to look after their own health and well-being. And the evidence would suggest we get much better health outcomes for everyone if the staff are well and healthy. The big challenge for general practices as we look to the future is one of shifting out of the norms, out of the way we currently do things, while preserving the very good practice, but majoring on promoting well-being and independence through less medical routes. The pilot will run from September to November of this year. We propose, of course, to fully utilise the new primary care funding committed by Scottish Government to progress further modernisation and innovation. So one of the big challenges ahead is the integration of health and social care. We have a very good history of working with local authority, with third sector and with other partners. This will provide us with a good base for integration and community planning. We've appointed 3 excellent chief officers and have established transitional leadership groups, which are now called Shadow Integrated Joint Boards, in Aberdeen City, in Murray and in Aberdeenshire. New integrated arrangements for health and social care will be in place during 2015, and we're on target with our planning. Communities will be at the forefront of future success and will be involved in developing the joint strategic plans. Another great advantage we have in Grampian is the presence of 2 world-class universities. We're working with the universities around a team-based approach to attracting staff, linking care, teaching and research. We have a proactive approach to recruitment, including attending recruitment fairs, manning stands in shopping centres and using social media. With the Robert Gordon University, we've developed an excellent return to work scheme to welcome back to employment nurses whose registration has lapsed. And we continue to explore options for the provision of affordable houses, one of the big challenges for this region, with our partners. So I'm actually coming to a close now, but it would be remiss of me not to list a set of thank yous to friends, partners and supporters who've worked with us in this last year. The Wood Foundation, who've committed to development of a multi-storey car park, the Craig Group, who supported funds for a new MRI scanner, UCAN, who supported the establishment of the first robotic surgery service, the RVS, who've made major donations to the NHS, our endowment fund that keeps significant benefits to improving patient care. And there will be some of you in this room, the very, very generous people across the northeast of Scotland who've already raised over £500,000 towards the ARI roof garden. And finally, my last slide, my own very special and sincere thanks to everyone who works for and with NHS Grampian for sharing our values and for their ongoing commitment. Ladies and gentlemen, thank you very much.
Okay, well, thanks, Stephen, for setting the scene. And just before we move on to questions, the grafters, I think, are a great concept, and I've been a regular visitor to Grampian since becoming Cabinet Secretary, and the thing that has really stood out for me, whether it was the previous annual review back in January or today's annual review or the meetings and visits in between has been the dedicated staff that you have here in Grampian. I mean, we have dedicated staff throughout the whole of the NHS, but there's something particularly special about the staff here in Grampian who absolutely go the extra mile, and I want to put on record my thanks to them. You should be very, very proud of the work they do indeed. Now, this is now your time, so just a couple of words about how we're going to do this. I want to try and get as many questions in as possible, which means perhaps keeping the questions as brief as possible, but also keeping the answers as brief as possible, so that we can get through as many as we can. It would be good if you could say who you are. It wouldn't be appropriate to take questions about individual patients or individual staff members. The written questions, if you don't get to ask your question, they will receive a written answer. And also, if you're the sort of person who has a question but you're really not too keen to get up and ask it here, then we have at the back Tabitha and Yvonne. If you give people a wave, right at the back, you can either hand them a question or you can speak to them at the end, and we will ensure that you will get an answer. Okay? So, if you want to ask a question, if you could indicate, and I'll take a couple, lady here, gentleman at the back. Is there a third? We could take a group of 3 questions to start with. Yes, lady there. I couldn't see for the photographer here. So lady here at the front. Say who you are and what your question is.
Right, well, thanks for coming, and thank you all. My name is Kathleen Powderly. I work as an acupuncturist and a Chinese herbalist here in Grampian. I've been here for quite a few decades now. My question is to Grampian Health Board, and have you allocated any extra funds in the management of chronic pain services in view of the long-standing history of the longest waiting times, which are the worst in Scotland? From last year, there's been no update on these figures, and I'd be interested to know the answer to this. Thank you.
Okay, and take gentleman at the back, and then we'll have the lady in blue.
Thanks very much. My name is Dottie Ross. I used to be a medical director here, and now I am a patient, and I can tell you a very grateful one for modern medicine provided by exceptionally well-trained and committed doctors. And that's so in a number of my various body systems that are beginning to fall apart. I have a question related to one of those problems that I've had, which relates to ophthalmology. And I don't know if you have, before I go on, can I also just congratulate Steve and Malcolm on the fantastic work, and I mean this, that they've done in a very few months. And they have set the place going in the right direction. I do have one or two little quibbles about what I regard as things that still need to be looked at, and I'm really sorry to bring them up, but they do have to be brought up. First one then is ophthalmology. Very briefly, if you happen to have this excellent report, please admire the cover, if nothing else. Perhaps people at the top table don't have the report. Anyway, you will see there the vacancy rates in ophthalmology like a sawtooth. And for those medically qualified, that looks like VF. That's a dying patient's ECG, if you like. And that's what happened in ophthalmology when 3 sterling characters, researchers, left. And underneath, that's the blue line compared to Scotland. Now, to my mind, that was poor management. I'm sorry to be so blunt about that, but as a medical director, my job was not to take sides, but to sort things out for the patient's benefit. I do not think that happened in this instance. I would be very happy to speak to anybody about it, and don't feel that you have to give an answer right now, but if you'd like to comment on the current state of ophthalmology, which had very serious problems with staff vacancies, and as a result of that, there were long waiting lists for treatment. Okay. And I can just say, just to finish, I'm sorry, I personally had to wait 90 days for what should have been a 30-day wait. And if I could just tell you confidentially, I suffered some damage to my eye. I still have extremely good vision because of modern medicine and because of these doctors with whom I started. Thank you for listening.
Thank you, sir. And lady in blue.
Thank you. Aileen Brown, Chairman of the Elderly Monitoring Group, Public Rep and Practice Rep. I noted what you said earlier about the paediatric clinical psychology service. The general practice would like to know, have you been able to recruit any more clinical psychologists for the elderly population, as the waiting time is unacceptably long?
Right, so we have three very important questions, all very different, focusing on different parts of the service. Can I just also agree with the gentleman at the back that I think we have seen some very positive developments and change with the new leadership team in place here. I think that's certainly reflected in the comments I had today from staff and patients. So can I ask, do you want Malcolm to tackle, we've got one on acupuncture and the issue of chronic pain services, we've got one on ophthalmology, and we've got one on clinical psychologists for the elderly.
Okay. I'll maybe start off answering all of those three questions, and I'll ask our medical director, Nick Fluck, to come in on the back of that. I think, first of all, chronic pain services, we know we've got specific challenges, particularly in the north of the region, and Dr. Gray's hospital in Elgin. I think we're working really hard to recruit staff there, and we've had dialogue with the local community about how we'll get that chronic pain service up and running there, and maybe Nick, you can comment in a bit more detail on that. I think with ophthalmology, I think what we've got is a department that has recovered really well from some real challenges that it had a number of years ago. We've got a very active eye health network here within the region, which has been externally reviewed. It is now fully staffed, certainly in Aberdeen. We have some vacancies within the north of the region. And our sense is that that is a well-led, it's a well-functioning department that is meeting high clinical standards. And then I think thirdly about psychology and clinical psychology, again we've got specific challenges around recruitment of psychologists. We have not been meeting all of our waiting time guarantee targets over a period of time. We've seen some really very significant improvements there with new staff being appointed, and we've got further more new staff to be take up post later on this calendar year. So we're not where we need to be, but the situation is improving. But maybe could I ask Nick if you could comment on some of those issues?
Thank you, Malcolm. Thank you, Cabinet Secretary. I'm going to take the opportunity of moving near the door, which is a nice bit cooler breeze for there. Okay, so chronic pain. I'm very happy to meet and do some detailed work, because I think you've probably got quite a lot of specific questions there that we should sit down and go through. I think the thing with chronic pain services is the direction of travel for us is to move very much away from the idea that we're trying to refer people into a centralised service. So we're moving away from growing a centralised secondary care pain service and moving much more into the notion that this is an integrated service. And in fact, pain management is something that all of us face as clinicians. So I'm a clinician, and pain management must occupy about a quarter of the work I do, and I'm a kidney doctor. And so I think what's important is for us to move towards something that's integrated, where we actually deliver and upskill people so people have the skills to address pain as they see it. Now, I think with the development of the integrated joint boards, modernising primary care, this is a tableau which allows us to sort of get into that dialogue, and getting away from the dialogue that pain is something that is dealt with by a small group of people, because as we all know in this audience, pain is something that we all have issues with, and therefore you want the healthcare profession you see to be able to address it and also to signpost you to the right places. I appreciate that I'm not giving you specifics of the data. We can find that and sit down and go through that with you. But that's the principle of the direction of travel. In terms of ophthalmology, I think Malcolm has made one or two statements around that. I guess just about, I mean, ophthalmology is a hugely busy service. There's a massive demand from it. I've been along, my boy's been along, so everyone knows that eye conditions are very, very important. We also recognise that we have turnover of staff from time to time, and staff leave for all sorts of different reasons. The journey, though, that ophthalmology has been on is a really productive and positive one. At the moment, in terms of, say, consultants in Aberdeen, we're up to a situation where we're fully staffed, so that's very positive. But there's something that underpins it that I want to explain to you that really shows the sort of journey it's made. Not only is it got innovative solutions of how to deliver eye care into the community, if we look about our situation, say 5 or 6 years ago, we were in a situation where our trainees, to be honest, didn't give us the best reports about how they got on here. And when they came to the point of coming and applying for consultant posts, they were applying outside of Grampian. We now have seen a progressive improvement in the last 3 years of happiness and engagement with our trainees, and in the latest round of consultant recruitment, all of them came from our own trainees, and every trainee we've got now wants to stay in Grampian. And that really is the message of how we're sort of trying to turn it round to deliver sustainability. The innovation in eye health care is exemplary. We've got nurses doing specialised injections. We're just looking into services about how to deliver services remotely in Elgin, where an ophthalmologist is able to be in Aberdeen and someone drives the camera to look in the back of your eye sitting in Elgin. So innovation is absolutely in there. Okay.
Okay, thank you. We'll take next round of questions. If you could catch my eye. Yeah, take another couple. Yes. And third one. Right. So we have 1, 2, and 3. So gentlemen at the back, firstly. Say who you are.
Yes, hello. My name is Robert Payton. I'm a patient representative. I'm also the chairman of GCRA. My question was on the CHD-MCN, and it was a written question anyway, and I have had a reply since writing the question. I would only like to point out that the CHD-MCN and other MCNs and other bodies within the NHS Grampian have a lot of people who are coming in on a voluntary basis just to try and help the service. This particular MCN hasn't had a meeting since last August. None of the people who are on a voluntary basis have been informed why. Now that was really my question. And the thing is that you really need to have respect for these people that are coming in and doing a job for you. If you don't have that, then you don't have anything really.
Well, we'll certainly get to the bottom of that in a second. Lady here.
Thank you. My name's Anne Bell and I use the NHS service. My concern is about whistleblowers who are suspended, and this, from my personal experience, causes huge concern to their patients, to their families, and to their relatives. And before they're suspended, the board must know that this is going to cause huge disruption to their patients and their lists, and also cost a lot of money. So my question is, what are the fully burdened costs of the suspensions for whistleblowers in the previous years, and what are the ongoing costs that are going to be incurred, and what, as a result, is going to have to be sacrificed? Thank you.
Okay, and now, gentleman, I've lost where he was now. Who was the third person? It was someone on this side. Oh, sorry, I thought it was... My apologies.
I'm not a man.
Sorry. My apologies.
Hi, my name is Kate Shand, and my question is also about it's about the surgeons that have been suspended, and I wanted to know what the time scale is for the resolution of this situation. Thank you. That's it.
Okay. So can we start with the question about the MCN from the gentleman at the back, please?
Well, thank you for that question, and I think I just want to reiterate the apology that we have not been in touch, and I understand the conversations have taken place and we've sought to rectify that. And I think there was one other submitted question on a similar line around somebody who'd been involved in clinical governance and the committee hadn't met and people hadn't been in contact. And I don't think that's the right way to approach things, and we'll seek to remedy that. So I think if anyone's got any concerns around any of that, please let myself or Laura Gray or others know, and we'll seek to address that. I think the principle of involving the public in the way that we run our services is absolutely central, and we've got a whole range of mechanisms to involve members of the public. I think having that voice and that view and that perspective, really to kind of shine a light and to give that perspective is really very powerful indeed. So I think if individuals feel let down by that, then I apologise for that, and we'll seek to rectify that.
Okay, so the next two questions are similar, covering the area of whistleblowers, and then specifically around timescale for the ongoing investigation and process around those suspended. Can I just say firstly a word about whistleblowing, because we have recently sought to strengthen some of the procedures and policies around whistleblowing in the NHS in the light of the Francis report. So we're taking a number of steps, particularly around identifying an independent person within boards that people could go to who is not part of a management structure, for example, who they could raise concerns with. So there's a whole, and that was one of the Francis recommendations, a whole range of recommendations. So just to assure you that we are taking those forward on a national basis. Now, clearly, some of the issues concerned in these two questions were covered to some extent by Stephen's contribution in his opening remarks. Obviously, we can't talk about individuals, but I wonder if we could just say a little bit more around in answer to the questions.
Yeah. Right, thank you for that. I think I'd just like to take half a step back first and just talk about the 3 reports that were published on the beginning of December of last year. This board received 3 highly critical external reports with a whole set of recommendations around them. And what we've sought to do is to take every single recommendation from each report and give an absolute commitment that we will take each of those recommendations through to conclusion. So one of the things that Alan Gray has been leading on is a tracker plan, which we have published and we've taken to the board, that gives that line through from every single recommendation through to what we're doing about it and bringing those things to conclusion. The Royal College of Surgeons report itself was a very concerning external review. This was done by the professional body, about a group of surgeons coming in and having a review with the surgical department. And over 80 people were interviewed as part of that review. And the vast majority of those people interviewed and who gave information to the review were clinicians rather than managers. So those recommendations, I think there were 29 recommendations came out of the Royal College of Surgeons report. I'm not going to go through those in detail, but I think if anyone reads those recommendations, they would be left in no doubt whatsoever that there were a number of very serious things at the back of this and that we needed to see these issues through. And some of them are around individuals, some of them around processes and systems, and some of that. I think what I would like to do is to commend the Department of General Surgery for the way in which they have approached this. And I know that there are work streams going on, people are leading those bits of work, and we're seeing some real improvements and some real energy and enthusiasm within the Department of General Surgery to take those recommendations forward. I think one point of us not being able to talk about individual cases, and we can't because we have the duty to respect the confidentiality of not just those who are subject to processes, but all of those others involved in the case. So, from a Data Protection Act point of view, we cannot talk about individual cases. But I suppose one of the outcomes of that is that a number of things get into the public domain that simply aren't true. So, for example, I saw one of the questions down today to say, well, why did Grampian refer 8 surgeons to the General Medical Council? Now, the position is we did not refer 8 surgeons to the General Medical Council, and the General Medical Council will confirm that. What we did do was to share the full report of the Royal College of Surgeons with General Medical Council. The GMC have said to us that not to have done that would have been a dereliction of duty on behalf of the board and indeed of any doctor who was in possession of that information. The Royal College of the GMC themselves, having got that report, they took the decision to open up a number of cases that met their threshold and their criteria. So because we can't talk about individual cases, that sort of information becomes current, and people genuinely believe that we've referred surgeons to the GMC, and we haven't. So I really would just like to make that clear. So all of those recommendations within the surgical report, I think, are serious. I think the department accepted the recommendations, and there's a real determination to move those issues forward. And I think I'll just refer you back to what the chair said right at the beginning. I think it's very important that as an employer of 14,000 staff, not just 2 or 3 or a handful of 14,000 staff, that we treat all staff equitably, fairly, and by the same rules and the same standards of conduct. And that I know is something that we give very high priority to. So the point about, does the board suspend whistleblowers? We don't suspend whistleblowers. We suspend a very small number of, tiny numbers of our staff every year. Those suspensions are done in accordance with HR terms and conditions and processes. We take proper advice before doing it. And of course, we make no judgment whatsoever on the outcome of individual cases. So to answer your question, we haven't suspended whistleblowers, but we've taken appropriate action in response to a series of reports that have come in.
And if I could just add, as Cabinet Secretary, I of course expect boards, whether it's Grampian or any other board, to treat all staff equally, and no matter who you are within the NHS, everybody should be subject to the same requirements of standards and conduct of behaviour. Now, maybe just to add a little bit more, Malcolm, on the cost of making sure that sessions are covered and that patients are seen will of course have been met by the board, and the time scale is quite difficult to put on, because at the end of the day due process has to be gone through, whether that's the board's due process or whether it's the regulator's due process. Yes. So it's quite difficult to put a time frame.
I think that's absolutely right, Cabinet Secretary, and the processes for disciplinary action in and around consultants are actually quite different from other members of staff within the system. And I think what we're committed to do is follow those processes through fairly, without fear nor favour, to a conclusion that is the most appropriate conclusion, and we'll do that as quickly as we possibly can. But these things are serious and they take time. And Cabinet Secretary, as you rightly said, the GMC processes are separate to those processes of the board. So they will be looking at a whole range of bits of evidence too, and they will come to their conclusions within their timescale. And that is not something that the board can influence in any way.
Okay. Another indication. Now, I've got 2 people on this side. Is there anyone on this side? Yes, lady in blue. So, I've got the gentleman, and then I've got the lady in front, and then I've got the lady in blue over here. Remember to say who you are.
Hello, I'm Jamie Weir. I was a previous professor of radiology here, and I'm chairman of a local patient group called PACT, Patient Action Communication Team. In your advertisement for this meeting, you indicated that and invited members of the general public to submit questions that may be answered by yourself or by Professor Logan. We carefully put 12 questions together. Do I take it that none are going to be answered today?
Well, when I conduct annual reviews. Normally, we would give the opportunity for people who are present to ask their question that they've put in as a written question. The opportunity is there to ask that question. But as I said at the beginning, if we don't manage to get round all of the questions that would have been submitted and asked verbally, and of course it would be difficult to get through 12 from one individual person, then we would write. But if you want to take the opportunity to ask one of those at the moment, that would be the idea behind the questions, that people who are here get to ask their question verbally, and those who are not would receive a written answer. So if you want to ask one of your questions...
Thank you very much, but I would actually, the questions were very carefully thought out and they require a very careful response, not something which was going to be asked off the cuff today. So I'm assuming and I'm hoping that we shall receive those answers, and when we do, they will be published in the P&J. Thank you.
Okay, well, I can absolutely assure you that you'll receive a written response, and we're happy to put all of that on the web. I should have said, actually, that the session we're going to have with the board later, the outcomes of that will be published on the NHS Grampian's website, so we can make sure that answers to written questions are done likewise. So I had the lady in front.
Thank you. My name's Morag Andrew. I'm a public representative since I retired 4 years ago, and I have volunteered for various parts of the NHS throughout Scotland and Grampian, one of them being the Children's Hospital, another one being the Scottish Ambulance Service, and the last one being RGU, the Robert Gordon's University. I have had all my questions mostly answered by Yvonne and her colleague, which I'm happy to have had responded to. But I would like to commend the Scottish Ambulance Service, because their treatment of me has been excellent over the past 4 years that I've been volunteering for them. They have communicated well with me, they have encouraged me to attend meetings and been able to make the facility for me to attend a meeting in absentia through a telephone link. I'm very impressed with the Scottish Ambulance Service and their treatment of me as a public representative. I'm also very pleased to see that the Robert Gordon's University that I volunteer for too, their treatment of me is excellent. But the questions that I put, 5-part questions, which have all been answered, I think, by the team at the back, the question I had really was about the Children's Hospital. Their treatment of me as a public rep was not at all good. I'm very disappointed in that. So I leave you with the 2 areas that I have had excellent service from. That is the Scottish Ambulance Service. Those people are a credit to Scotland, and RGU. Excellent. Thank you very much.
Well, okay. First of all, Morag, can I thank you for your volunteering, first of all, and everybody else who volunteers. Volunteers play a really important role in the NHS, and can I say that I'm actually chairing the Scottish Ambulance Service's annual review in a couple of weeks, so I'll make sure that your comments are passed on to them, but we'll also pick up your comments about the Children's Hospital as well. So moving on to the lady here.
Thank you. My name is Hazel Carnegie, and I did submit a written question, and I know that I'm going to get some feedback, follow-up feedback, for which I'm very grateful, but it may be of more general interest. I actually attended the consultation that took place about the 2 new buildings on the hospital campus, and I was very impressed by that consultation, particularly because it was taking place before the board went to take forward the planning application for the buildings. However, the one area of concern I had was exactly what's going to happen in the meantime, in the next 5 years, before those buildings are finished and commissioned. In particular, the Anchor Centre. I'm actually a patient at the Anchor unit, and I know how very busy the outpatients clinics are and how pressed for space they are in the existing facility. Now, I do understand that the old part of the hospital is no longer really fit for modern purpose. The buildings are expensive to reconfigure and refurbish, and that the board won't want to spend a lot of money on them in the meantime. But my concern really was just for the contingency plans to take things forward over the next 5 years before these super new facilities become available. Thank you.
Malcolm, do you want to questions?
Yes, I'll start off in terms of the Children's Hospital issue, and also say something about the developments on the Forester Hill site, and maybe ask Graham Smith to come in on the back of that in and around the anchor unit. First of all, with regard to clinical governance in the Children's Hospital, again, we apologise for that. We should have engaged with you. We haven't, and I know since your question came in, there's been some discussion, and we hope we can get some of those arrangements up and running again. So your point is well taken. Secondly, in and around the Forester Hill campus, one of the really exciting things about NHS Grampian right now is the level of capital investment that is going into that Forester Hill site. And given the constraints on the site, there's a lot of movement around to be done. But I think getting the new anchor unit, getting the bed family hospital funded, and making sure that all of that programme moves forward really rapidly, I think is just fantastic. We've got a programme of work to do backlog maintenance in the older parts of Aberdeen Royal Infirmary, and that's quite a complex process. And we're going to have to relocate the Forester Hill Health Centre as well. So there's a whole series of complex interrelated moves that are going to have to take place here over the next few years. And Graham, we'd like to say something a bit more about that, particularly around the anchor unit.
Yes, thanks very much. For those of you who know the Forester Hill campus, you'll have seen a huge change over the last 5 years or so. We've got the Emergency Care Centre, or the Matthew Hay Building as it's now called. We've been doing significant internal works and backlog maintenance to the inpatient areas, and we were delighted about the announcement of the Baird Family Hospital and the Anchor Centre last year. And as has been said, there's a huge amount of work and really motivated staff planning the detail of those facilities. But as you're aware, as you've said, it's going to be a few years before these facilities come on stream. There are issues for some services who are in comparatively poor accommodation, mainly in relation to the space that's available. We know that's the case with haematology, and we know that there are issues in relation to dermatology and a number of other services. So what we have done is we've asked a number of services to be clear about what their accommodation requirements are. There will be some additional space which is available for a temporary period up until the new facilities are available. And over the next 2 months, a group which involves a number of clinicians and managers will look at the requirements, look at the space available, and try and make the best decisions about how we use space over the next 4 to 5 years. So we're aware of what the requirements are, we're aware of what the space availability is, and we just need a couple of months to reconcile the two and come up with a final decision. But what I'm going to do, Cabinet Secretary, is meet with the questioner towards the end of next week, and we're going to go over all the changes at Forester Hill in a bit of detail so that there's a good understanding and maybe a bit of advice coming as well as to how we improve the situation. Thank you.
Okay, we're just about out of time, which we've managed to get through quite a few questions. If there's anybody who has a burning question that we've not managed to get through, I'm sorry, you're chancing your arm, you've been in already, but we'll speak to you after. Anybody else who's not had a chance to ask a question? Yes, lady here, you can be the last questioner of the afternoon.
Hello, I'm Mary Rasmussen. I serve on the PPFI committee and I'm a lay advisor in medical education. I'm also a guide dog owner. Your burning question is about smoking. I'm delighted, along with everybody else, that there is no smoking in the grounds of the hospital. I am aware that residents' concerns have been expressed. Can I express too, on behalf of my dog, the fact that he recently stepped on a burning cigarette and severely burnt his foot. And my plea would be that even though there isn't smoking within the grounds of the hospital, please, on the places where people do congregate to smoke, can we have some kind of receptacle that will contain their ousted cigarette ends? Thank you.
Well, yeah, absolutely. Malcolm, do you want to respond to that?
Yes, I think that's a very powerful point you make. I mean, I think the principle of not having any smoking on any of the NHS grounds is a very strong one. It's been strongly supported, and we've had great partnership working with our staff about how we can put that in place. And as you rightly say, there's a set of knock-on consequences, and we have been in dialogue with the neighbours about it in and around, as they say, in and around the Forester Hill site. I think one of the things we are doing is working with Aberdeen City Council to talk about how we can get receptacles and how we can tidy the place up, and also issuing smokers with little bins in which to stub their cigarettes out, if they have to go outside the hospital grounds for a cigarette. So we're very conscious, and I'm really sorry to hear the experience that your dog had around that. I mean, it must have been really painful and awful, so I'm sorry about that.
Okay, thanks for that last question, Mary. So I want to just thank you all for coming along to the public session of the annual review. Thank you all for bearing with us through the heat. It has been, but I think also the fact that we've had so many people here this afternoon is good. I think that shows a level of interest, and we've had a good range of questions about a good range of different subjects. So just to reiterate, any questions that haven't been answered in terms of the written questions will receive a full answer, and we will make sure that those answers are published on NHS Grampian's website. If you have a question, you've still got a chance to give to Tabitha or Yvonne at the back. Just hand them a bit of paper or speak to them, and we'll make sure that you get a reply. And can I thank the guys here from, obviously from Stephen and Malcolm from the board and my team for their support this afternoon, but more importantly thank the staff and everybody who's made this annual review possible, but particularly you, the public, for coming along and giving us a good range of questions. Thank you very much. Thank you.